Ever heard of HMPV? This little-known virus is infecting millions worldwide, yet most people don't even know they have it. 5 years after the outbreak of the deadly COVID-19 pandemic, China is reportedly witnessing an outbreak of human Metapneumovirus or HMPV. Here's what you need to know to protect yourself and your loved ones. HMPV is a viral infection that primarily affects the respiratory system. It belongs to the Paramyxoviridae family, which also includes viruses like Respiratory syncytial virus and measles. Though first identified in 2001, HMPV is thought to have been circulating among humans for decades. There has been a significant increase in reports of HMPV infections in China. Now cases are being reported from other countries like India too. According to recent reports, this surge is particularly affecting children under the age of 14, with northern provinces seeing a greater increase in cases. China's National Administration for Disease Control and Prevention has responded by operating a surveillance system for respiratory diseases, including pneumonia of unknown origin, to better manage and detect these infections. This increase in HMPV cases comes at a time when other respiratory illnesses are also on the rise, increasing congestion in hospitals during the winter season. However, people are advised not to panic due to the HMPV outbreak in China, as HMPV causes common cold-like symptoms, especially in the elderly and infants. Who does it affect? While it can infect individuals of all ages, it is particularly severe for young children, the elderly, and those with weakened immune systems like cancer patients, organ transplant recipients, people with chronic lung diseases. How does it spread? HMPV spreads similarly to other respiratory viruses. It's transmitted through coughing and sneezing by an infected person, direct contact with contaminated surfaces, and close contact with infected individuals. The virus is most contagious in the first few days of symptoms, but can still spread even with mild symptoms. How does it manifest? Symptoms of an HMPV infection can range from mild to severe, often resembling those of a cold or flu. Common symptoms include fever, cough, runny nose, sore throat, wheezing, shortness of breath, fatigue, and headache. In some cases, especially in vulnerable groups, HMPV can cause more severe respiratory illness such as pneumonia or bronchiolitis. The incubation period, the time from exposure to symptom onset, typically lasts between 3 to 6 days. Most cases of HMPV are self-limiting, with symptoms lasting for about 1 to 2 weeks. While many people recover from HMPV without any complications, certain groups are at greater risk for severe illness. These include infants and young children, especially those under 5. Older adults, particularly those over 65, immunocompromised individuals, and people with chronic lung diseases like asthma or COPD. How is it diagnosed? HMPV is diagnosed through clinical evaluation, which includes considering the symptoms and patient history. For confirmation, nasal swabs or throat samples can be tested in the laboratory using methods like PCR or RT-PCR. Routine respiratory virus panels typically do not include HMPV unless specifically requested. Given the increase in HMPV cases, clinicians should maintain a high index of suspicion for this virus, especially in areas where increased activity has been reported. Continuing education on respiratory virus management and infection control practices remains important. How is it treated? Is there any specific treatment available for it? Currently, there are no specific antiviral medications approved for HMPV infection. Treatment focuses on relieving symptoms. Rest, hydration, fever reducers like paracetamol or ibuprofen, decongestants and inhalers, or oxygen therapy for those experiencing breathing difficulties. In severe cases, hospitalization may be necessary. Keep in mind that antibiotics are ineffective because HMPV is a virus, not a bacterial infection. How can you protect yourself from HMPV? Since HMPV is a respiratory virus, preventive measures focus on reducing exposure. These include frequent hand washing with soap and water, avoiding close contact with infected individuals, covering coughs and sneezes, disinfecting surfaces, and staying home when feeling sick. Eat healthy food, exercise, and get enough sleep to boost immunity. Where does the future lie? Is there a vaccine coming for HMPV? Researchers are actively working on potential vaccines for HMPV, especially for high-risk individuals. Some experimental vaccines have shown promise, but none are currently available for public use. In addition, research continues into antiviral drugs specifically targeting HMPV. That's it for now, folks. See you next time. Keep watching MedGrow and take care of yourself.